At the 8th Annual Chicago Supportive Oncology Conference, Dr. Debra Barton shared some highlights from the 2012 meeting of the American Society of Clinical Oncology. We caught up with her to get the details.
The exciting thing about ASCO this year was that in the patient survivor care track, often, although we get a lot of great science submitted and a lot of abstracts submitted, a lot of times it's all about what not to do, what didn't work. And this year at ASCO, we actually had several positive studies for supportive care, which was very exciting. The abstracts that I am going to talk about are related to vitamin D for arthralgias and myalgias related to aromatase inhibitor therapy. It was a study done by the University of Kansas investigators and a cancer center in Wichita. And the investigators looked at 30,000 international units of vitamin D to try to help the aches and pains that are in the muscles and the joints related to aromatase inhibitor therapy. And actually found that there looks like there is some help from adequate levels of vitamin D, defined as over 40 nanograms per milliliter. The study does need to be replicated because there was a little bit of a issue with the way that they measured the outcome. With one pain scale it wasn't significant, with another pain scale it was. So they are actually going to replicate the study in a large multi-site group. Our group actually studied ginseng, American ginseng, for cancer-related fatigue and found that 2,000 milligrams a day was statistically significantly better than placebo for fatigue. Now you have to keep in mind that since ginseng is a dietary supplement, it's not regulated by the FDA. Anything that you pick up over the counter could be quite variable in what's in it. So I always advise patients to stay with companies that are large and have a reputation for pharmaceuticals because they know good manufacturing processes and are more likely to be honest and truthful about what's on the label and how they handle their product. It's also important that people know that the ginseng that we studied was a ground root and not an extract. Extracting can change the characteristics of ginseng, and sometimes it's not the kind of extracts that are used are contraindicated in patients with breast cancer. Another cancer-related fatigue study is dexamethasone, and this study was in advanced cancer patients, and this was done by the group at MD Anderson. And they looked at, it was a 2-week study, so it was very short. It was in advanced cancer patients. They looked at dexamethasone 4 milligrams twice a day and found that in as early as 1 week, there was significant improvement in fatigue in these advanced patients, which lasted the second week. So for short-term use, this is very exciting. It's the first randomized controlled trial that actually looked at fatigue as an endpoint. There have been some studies saying that dexamethasone seems to help symptoms. There's also some literature stating that perhaps this is more of a euphoric effect, that it actually doesn't help physical symptoms. But the MD Anderson group looked at distress, looked at psychological distress, physical distress, and some other physical subscales on the FACT, which is a well-known measure of quality of life. And they found that it didn't have psychological effects. They were all physical. So they believe firmly that this does help a physical symptom profile. And they also had a measure of cachexia and found that that also was improved. So something to think about short-term use in advanced cancer patients. Steroids, dexamethasone, have a very well-known side effect profile. There are some contraindications such as diabetes. So it's important, I think, to, if you try dexamethasone in patients, that you check very carefully for that risk-benefit ratio, that patients aren't having more side effects than benefit. And then the last two things I'm going to talk about are also in advanced disease. One is a study of early integration of palliative care at Princess Margaret. It's Dr. Zimmerman's study, and did add to the evidence base that is growing that early palliative care is very important and has some good outcomes. They did show outcomes by 4 months in improvement in quality of life and spirituality, particularly. They also showed by 3 months strong improvement in satisfaction by a satisfaction measure that even include family members. So I think that's a very powerful finding. They didn't have much impact on symptom management as measured by the Edmonton Symptom Assessment Scale, but for example, we talked at this meeting yesterday that there's a lot of reasons that could possibly explain not having big significant changes in a symptom score in advanced cancer patients. And then the last one was actually my favorite abstract at ASCO. And this was the use of a video to help patients understand and decide about getting CPR, which is cardiopulmonary resuscitation, which is a very hard conversation to have with people. So this group of investigators from Dana-Farber developed a 3-minute video actually showing CPR, and they developed it with a panel of folks, including ethicists and family members and patients. So they developed this video and then randomized patients and families to either see the video along with a conversation with their provider or just the conversation. And then they looked at knowledge and they looked at CPR preferences after that intervention. But then they also looked 2 months later to see, did preferences change or were they stable? And what they found was that the video really increased significantly the number of people who decided against having CPR and improved knowledge statistically significantly as well over just having the conversation. And interestingly, at 8 weeks or 2 months later, they still had the same preference difference, that more patients who saw the video along with the discussion chose against CPR.